Last week, Governor Greg Abbott signed an executive order that would require public hospitals to keep tab of health care costs incurred for undocumented immigrants. It's brought some confusion to hospitals, but as our Jesus Martinez shares, this is an effort for the federal government to reimburse the Lone Star State on cost of care.
And for the rest of the nation to understand really what the Texas taxpayers are having to bear.
And that's the bottom line of Governor Abbott's executive order. Cost. Starting November 1st, Texas hospitals will start to ask patients about their immigration status to tally up the cost of care. That bill will then be sent to the federal government.
That information is going to be very good for us to be able to make good decisions going forward.
Information that hospitals here in East Texas are still trying to digest. CBS 19 reached out to UT Health East Texas to figure out how they're going to comply with the executive order. They declined an on-camera interview, but said in a statement, quote, UT Health East Texas is committed to providing the highest quality of care while adhering to all legal and regulatory requirements, end quote. Christus Trinity Mother Francis Health System deferred all comments to the Texas Association of Hospitals, a group that advocates for hospitals, and they too declined an on-camera interview as they analyzed this executive order, but gave a statement to our sister station in Austin reading, quote, right now hospitals don't ask about patient immigration status as a condition of treatment. Hospitals are required by law to provide life-saving treatment to anyone, regardless of ability to pay or status, end quote.
Hospitals in East Texas and across this state do such a great job of making sure to treat people regardless of who they are, where they come from. They're gonna give them the medical treatment they need.
But I believe this executive order is unconstitutional, and I'm going to stand to fight the executive order because in an emergency, every person deserves to get health care, deserves to get it immediately.
U.S. Representative Al Green, who represents the greater Houston area, said earlier this week that the executive order could discourage people from seeking medical care.
That this information would not be used against them. It's just an accumulation of data and nothing more than that.
Executive Director for the Hispanic American Association, Gilberto Urbina, is encouraging people to continue seeking medical care even if this executive order does go into effect.
They think that all their personal information is being collected, and therefore they may fear that it could be used against them.
So whatever policies we institute, we've got to be sure it protects our Texas taxpayers.
For CBS 19, I'm Jesus Martinez.
Under this executive order, Texas hospitals would have to submit data quarterly, with the first submission due March 1st of next year.